Hello, good afternoon, good morning, or good evening from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic, and today I am very pleased to be joined by Dr. Kate O'Brien, who is WHO's Director for Vaccines, Immunization Vaccines, and Biologicals. Hello, Kate. I'm sure you know her from our previous conversations about vaccines. And also we have today Anil Soni, who is WHO Foundation Chief Executive Officer. Hello, Anil.
Hi.
Thank you for joining us in this conversation as we are marking the World Immunization Week. There is also a campaign that you can join to support COVID-19 vaccination that Anil will tell us more about. So if you're watching us on Twitter, please use the hashtag AskWHO to send us your questions. If you're watching us on Facebook, LinkedIn, or YouTube, as usual, you can leave your questions via comments section. I will start with obviously the theme of the Immunization Week, which is vaccines bring us closer. So Kate, would you please tell our viewers how vaccines bring us closer?
Sure. So yes, this is World Immunization Week, and the theme is vaccines bring us closer, and they bring us closer in so many different ways. Vaccines are life-saving products. So they bring us closer, first of all, to the end of diseases that threaten children, adults, adolescents around the world. They bring us closer to the end of polio, to the end of measles as a threat for the lives of children. They bring us closer to our families. We've seen that, throughout this pandemic, that we are not able to see our families, our friends, our loved ones in the ways that we want to. They're protecting us from transmission, they're protecting us from disease, and they bring us closer to a world of greater equity when everyone, everywhere is protected from life-threatening diseases through the use of vaccines. They also bring us closer to children who have the opportunity for excelling in education when they're not threatened by diseases like meningitis that leave residual effects. So there's so many ways in which vaccines bring us closer. And I invite all of you to think about the way in which a vaccine brings you closer to and fill in what you want there. For me, it's bringing us closer to the freedoms that we have been so used to and enjoyed and lost during this pandemic period.
Thank you so much, Kate. And as throughout our social media channels this week, we are inviting everyone to join us in amplifying the message of this campaign, but also sharing to what you look forward vaccines bringing you closer to. You can check our Instagram, Facebook, LinkedIn stories or Twitter fleets, or you can use actually our filter that was kicked off yesterday. You can only search vaccines work on Instagram, and please send us your videos. We are looking forward to seeing your creative ideas. And in this moment, maybe I'll ask Anil, what vaccines brought you closer to in your life, or what do you look forward that vaccines will bring you closer to in future?
Well, vaccines have brought me closer to achieving all of my aspirations. As a child, I received a number of vaccines that are all too routine in a country where I grew up in the United States and all too uncommon in other parts of the world. So vaccines bring me closer to my own potential.
Thank you so much, Anil. Kate, what are the objectives of this year's Immunization Week? The hottest topic nowadays are COVID-19 vaccines, but our campaign is broader than that. So maybe you can share the objectives.
Yeah, so as we're in addition to World Immunization Week as a celebration of what vaccines do and what their objectives are, we're also launching the Decade of Vaccines, this new strategy for the decade. And the goals for this new decade, the Immunization Agenda 2030, what can we achieve by the end of this decade that we've just started? We are aiming through this worldwide strategy that has involved all countries actually agreeing to what we're going to aspire to. The aim of the decade is to prevent 50 million deaths that would otherwise occur during the decade. And we do that by introducing at least 500 new vaccine or underused vaccines introductions especially in low and middle income countries, achieving 90% coverage of the key life-saving vaccines in every country around the world, and reduce half the number of children who are completely left out of essential immunization that are otherwise provided by programs around the world. And if we do all those things, and we achieve all those things over the course of the decade, we will be at the mark of having prevented 50 million deaths that would otherwise occur if it weren't for these vaccines deployed in the size and the scope of what the decade is aspiring to. And I think one of the things that I really want to emphasize is that every single one of us lives in a country that actually deploys vaccines. Vaccines are the most widely deployed intervention of any intervention around the world. And so sometimes we can take them for granted. And I think COVID-19 has really shown us, and so many people around the world, the importance of what seems like a routine intervention is not routine at all. And we can have the collapse of those interventions. And we really need to guard against that.
Thank you, Kate. And earlier this week, we actually released data showing how much the COVID pandemic has impacted and actually disrupted routine immunization. So can you tell us where people are missing their vaccine appointments and to receive needed vaccines the most?
Yes, so we've just released this report on the essential services, essential health services, and the disruption that countries are feeling in those essential services around the world. This is the second time that we've done a survey of countries. And what we've found is that things have improved since the first survey that was done in the spring of 2020. But here we are, almost a year beyond that, coming up to a year beyond that, and still 37% of countries are reporting that immunization services remain either moderately or substantially disrupted. And that means that there are millions of children, adolescents and adults who are not getting the vaccines that they are otherwise scheduled to receive and are in a point of risk because they aren't protected against those infections that they otherwise would be protected for. We have dozens of campaigns of vaccines against measles, yellow fever, diphtheria, polio, meningitis that have not taken place that were scheduled to take place. And countries are working really hard to get them going again and get them going in a way that's safe for both the providers who work on the campaigns and the families who come to receive those vaccines. But it means that still today, there are millions and millions of people who have missed out on the vaccines that they otherwise would have received. So what we really need is for governments to prioritize maintaining and recovering these essential health services, and especially the immunization program.
Thank you so much, Kate. And one of the actions in this Immunization Agenda 2030 is actually call to governments and donors to invest more in health systems and routine immunization. So Anil, the WHO Foundation has been created recently to support WHO and global health with attracting new funds and donors. So can you tell us a bit about that work and what is the plan ahead?
Absolutely. Well, the work of the WHO is life-saving work, including COVID, but not limited to COVID. So Kate just talked to you all about routine immunizations, about the range of diseases and infections that hold people back. I said that vaccines bring me closer to my potential. That's true for everyone. So the work of the WHO is to ensure that everyone in the world has health so that they can achieve their potential, including routine vaccinations, including access to the latest medical tools, including a health system that has nurses and doctors and community healthcare workers that can reach out to individuals, all so that we can achieve our potential. And the WHO Foundation was just created to mobilize more support from the private sector and from individuals, from you, those who are watching this video. Our goal is to democratize the engagement with the WHO and to ensure more support for its life-saving work.
Thank you so much, Anil. And Kate, why is routine immunization so important for viruses like measles or polio, for example?
Well, these are really transmissible viruses. That means that when one person is infected, the likelihood of people around them who are otherwise not immune becoming infected is extremely high. For measles, for every infected person, they go on to infect over a dozen and in some cases up to 20 people who are not immune just from that one person who's infectious. And so the reason why we need vaccines is that you can either become immune by getting disease, but disease means a risk of dying, or you can become immune by becoming immunized. And it is immunizations that are protecting not only those people who are immunized, but also protect people, the small number of people who are not able to be immunized, either because they have a condition that means that they can't be immunized. They may have an allergy, for instance, to something in the vaccine, or they have underlying medical conditions specific to that vaccine that means that it's not safe for them to be vaccinated. For instance, for some vaccines for people who have cancer. And so when everybody around them is vaccinated, it cocoons them and it protects even people who are not able to be vaccinated because of their own vulnerabilities. So that's the reason why it's so critical. And we're, especially for polio, where we're trying to eradicate polio. That means getting rid of the disease forever from the world. And there's only one disease that human disease that we've ever eradicated. That's smallpox. And we don't immunize against smallpox anymore because it doesn't exist. And so the benefit of eradicating a disease is eventually we can even remove the vaccine from the program. Governments don't have to pay for those vaccines anymore. And it's the most equitable achievement of a vaccine preventable disease is for it to be gone for everybody everywhere.
Thank you so much, Kate. And here is the question from Chanaya Mathad, who is saying that there's a lot of misleading information about vaccines that's spreading around, including on social media. Is WHO taking any steps in this direction?
We have a really active program to deal with vaccine misinformation. And some of that misinformation is pretty innocent. People misunderstand the issues and the how vaccines work. And some of it is actually very deliberate. It's deliberately spreading false information to scare people and to stir up discord. So we have a very active program. We work with social media companies to identify false information that is out there on social media, to limit the spread of that information. And of course, we've had misinformation for as long as there have been vaccines, from as far back as the 1700s. So misinformation or disinformation is not new. But what is new and what is highly threatening to these life-saving programs is the ability of that misinformation to spread, and to spread in an infectious way. And sometimes that misinformation spreads even more quickly than the germs, the pathogens that spread that we're actually immunizing against. And why do we care about that? Well, we've seen examples where people in communities start to believe the misinformation, and as a result, they do not seek immunization. And we've had terrible outbreaks of disease in communities and deaths from individuals, especially children, who have not been vaccinated because their parents didn't understand, because their parents had misinformation and didn't take their children for vaccines. And you can only imagine the grief of parents to have lost a child from something that was preventable, and to have not done what was possible to actually protect their child's life once they realized that the information they were acting on was completely false. So really encouraging people to seek information from credible sources, and to not believe everything that you see on the internet. If something seems extraordinary and sort of hard to believe, that's a piece of information that you should check out from a credible source. Don't pass it on unless you verify it.
Thank you so much, Kate. And we're receiving a lot of questions about COVID-19 vaccines, which is expected given the pandemic we are living in now. But the first, I want to take this comment from Jayakumar Padmanabha Pillai, who is saying this is the right moment to appreciate all the members of WHO for creating COVAX facility, but it's created with our partners, not just the WHO, to help those helpless and innocent people around the world through global solidarity. So I thank you so much for your positive feedback. And Kate, Maybe you can just clarify for others how COVAX is working and delivering vaccines to those who need it first.
Sure. So COVAX, I really want to invite, after I just mentioned briefly about what COVAX is. COVAX is a means to pull together vaccine supply and deploy that supply to countries around the world, especially to countries who are not able financially to afford these vaccines, and to deploy them in an equitable and fair way. And so COVAX aims to deliver 2 billion doses at least in 2021. There are 190 participants, meaning countries that are participating in COVAX, and 92 of those countries are receiving vaccines free of charge. And the aim is for those countries that are part of COVAX that are receiving vaccines free of charge is to get at least 30% now of the population in those countries with vaccine available to immunize those people who are at highest risk of getting COVID, so to protect the highest risk people. So that means deploying about 1.8 billion doses of vaccine to the 92 countries that receive vaccines free of charge. So that's the means by which WHO is participating in assuring that every country around the world has access to vaccines, and that we're protecting health workers and those at highest risk, the elderly and those with underlying conditions, who are most likely to be the ones who will get severe disease or hospitalization from disease. And let's get them all protected in every country to start with.
Thank you so much, Kate. And Anil, I really would like you to tell our viewers how they can help us that we vaccinate those who need to receive vaccines first and are not having the access at the moment.
I'm so excited to share that as of today, anyone, anywhere can contribute to make sure that everyone is getting the vaccine, starting with those who need them most. As Kate just said, we currently are working as an international community to get to 30% vaccine coverage levels in low-income countries, which means we focus on healthcare workers, we focus on the elderly, we focus on those with pre-existing conditions who were most at risk of this disease. We created a campaign called Go Give One. You can yourself gogiveone.org, and it allows anyone anywhere to make a small contribution to contribute to COVAX. So that fund that exists to ensure equitable distribution of vaccines to everyone in the world, that fund is now a fund you can access, and you can make a very small contribution and help someone else in the world. So please, Go Give One at gogiveone.org. And thanks to Facebook for creating the ability, at least for the members of the community in the US, the UK, Germany, and Norway, you can go create a fundraiser for Go Give One through the United Nations Foundation. And when you do that, Facebook is going to start your fundraiser off with a donation of its own up to $5 million. So this is an opportunity for everyone everywhere to contribute to COVID-19 vaccine equity.
Thank you so much, Anil. And I'll use a chance besides the website, gogiveone.org, for our followers to follow WHO Foundation across social media platforms, Facebook, Twitter, Instagram. You will get daily, I'm sure very often updates about the campaign and how you can help. Anil, for how long this campaign will be active?
Alex, that's a great question. It's going to be active well into next year. I am so very much hoping that this pandemic ends and ends soon, but all of us who work in these organizations and all of you are committed to the long term, making sure that we reach everyone with this vaccine and end the pandemic. That's a long-term commitment. So this campaign is starting today, but it's not going to go anywhere. It's an opportunity for everyone everywhere to make a contribution, to Go Give One. And we're going to be allowing people to do that into next year and launching this campaign in each country and making sure that people have the opportunity to access this campaign and COVAX yourself as individuals through religious institutions, through sporting teams, through influencers and celebrities, and also through businesses who are going to be putting the campaign in front of their employees and also in front of their customers. So I hope you see it soon, and I hope you spread the word. GoGiveOne.org.
Thank you so much, Anil. And again, I'm reminding our viewers, follow the WHO Foundation, visit the website gogiveone.org, and help someone in need to get vaccine as soon as possible. Kate, as there are no enough vaccine doses produced at the moment to reach everyone, what is WHO doing to work with countries to ensure vaccine equity and that health workers and those at highest risk of disease get vaccinated first?
Yeah, it's so important. There's some really critical things that are going on right now. The first is that we're providing advice to all countries about how to prioritize who should first get vaccine. So when those first shipments are coming or being produced in country, it's really important to be clear about what the highest priority groups are. And those are healthcare workers who are the ones that are taking care of all of us, not just for COVID, but they're the ones who are keeping our hospitals going for all of the other care that we need, the hospitals and clinics, really the heroes of our healthcare system. And the second is, apart from helping countries establish who should be prioritized and the supply that I've explained already through COVAX, the other things that WHO is doing is helping countries to regulate the vaccines that are coming in. We have lots of vaccines that are coming through clinical trials, and any vaccine that's going to be used in a routine program does need to be reviewed by regulators. The evidence on efficacy and safety and the quality of the manufacturing is really important because you are all relying on us to provide safe and effective vaccines. And so that regulatory process that we support all countries on is an important means by which you can be sure that the vaccines that you're getting are safe and efficacious. The next thing is that, as you mentioned, there isn't enough vaccine manufacturing going on to produce enough doses to provide for everybody in the time frame that we really want to have these vaccines as fast as possible. And so WHO is working with manufacturers, with countries, with academics, with anybody who has the ability to influence and to speed up manufacturing, including transferring this technology from existing manufacturers to other manufacturers who could start to produce these vaccines, and to be creating manufacturing opportunities, especially in parts of the world that don't have vaccine manufacturing to any great degree, in particular in Africa. So we're working very carefully now with manufacturers, academics, scientists, to start to share information and share the know-how. You need not only the recipe on how to make a vaccine, but you need to know how to do it. And so a program to share that information and develop a lot more manufacturing in all, so that there is capacity not only for COVID vaccine, but for all of the life-saving vaccines that we have, and for future vaccines that we know that we will need. This will unfortunately not be the last time that we have a new pathogen that we need to respond to.
Thank you so much, Kate. And here is the question from Nontanya Suksapsi. What COVID vaccines are certified by the World Health Organization at the moment?
Yes, we have 4 vaccines at WHO that are emergency use listed, meaning WHO has reviewed the process of the primary regulator that looked at the vaccine as it was first developed. And so the vaccines that have been looked at already include the Pfizer vaccine, the AstraZeneca vaccine, a number of sources of the AstraZeneca vaccine. We are also in the process of looking at the Sinovac and Sinopharm vaccines, which are under review this week and next week. We will be looking at the Moderna vaccine as well. We've done the Johnson & Johnson product. And so we're looking at any vaccine that a manufacturer believes they have the data that meet the highest international standards. We're working with many different manufacturers, including from the Sputnik V vaccine as well, that is under review. We do have a web page that shows the progress of each of the vaccines that's available publicly and is updated on a weekly basis. So you as the public can see what the progress is on the authorization, the review of each vaccine by WHO.
Thank you so much, Kate. And here's the question from our Twitter viewer. Can people receive different COVID-19 vaccines from different manufacturers due to limited access?
Again, a great question. There are many countries around the world that have more than one product in the country. We don't have data that says, can you receive one dose from one product and your second dose from another product? Are they basically interchangeable? We call that mix and match. We don't have data that tells us whether that's okay or not. So at this point, what we are recommending is that when you've received your first dose of a given product, it's the same product that should be given for the second dose. The only exception to that at this point is the AstraZeneca vaccine, which is being manufactured in a number of different places around the world, including by the Serum Institute of India, and it goes by a separate brand name there than it does in other parts of the world. Any of the manufacturers of the AstraZeneca product are considered interchangeable, and so that's the one exception. But otherwise, we don't have the information on whether or not it leads to the same impact. Those studies are underway, and we do expect to be able to give some information about mix and match regimens in the coming months.
Thank you, Kate. And here's a question from David Bruin. Shouldn't be sufficient to protect just vulnerable group of people with vaccines?
Sorry, can you just ask that again?
Shouldn't be sufficient to protect just the vulnerable group of people?
Well, that's one approach. One approach that countries could take is to say, we're going to aspire only to protect those people who are at highest risk of severe disease, hospitalization, or death, and the healthcare workers. And that would, in most countries, it would take about 20% of the population would fit into one of those groups. There's a range. Not every country is 20%, but on a global average, it's about 20%. But many countries have a different goal. And their goal is to shut down the transmission of this virus, the infection from one person to the next. And given that many people of any part of the population can be infected with COVID, that would require, if that's the goal of countries, it would require a much larger fraction of the population to be immunized and to be immune. And the reason to consider pursuing that goal is that in spite of the fact that there are some parts of the population that are at higher risk than others of severe disease, hospitalization, or death, there are certainly cases of serious disease in all parts of the population. The second reason is that as we are seeing variants emerging, mutations in this virus, we don't know whether or not there will be more risk in other parts of the population. And so the best chance for shutting down mutations in the virus and variants emerging is to get as high immunity as possible through vaccination for everybody in the community and get down to the very lowest amount of transmission from one person to the next.
Thank you so much, Kate. And speaking again of protecting the most vulnerable around the world, Anil, the campaign is called Go Give One. But can our viewers support with more than buying one vaccine for someone around the world who need it?
Yes, absolutely. It's an opportunity to give as generously as people can give. We wanted to make sure that it's clear to everyone in the world that even just giving one is an incredible act of solidarity. And by the way, getting vaccinated is an act of solidarity. Kate's the technical expert, but my understanding of vaccines is that when I get vaccinated, I'm not just protecting myself, I'm protecting my loved ones, I'm protecting my community, and I'm making my contribution towards ending the virus, ending the pandemic in the world, because the more of us who get vaccinated, the more we're going to stop the transmission of the virus. And that's incredibly important to ensure that we're stopping disease and mortality associated with COVID-19. So every vaccine matters. Go give one, go give many as you want to give and as much as you can give to support the supply of vaccines to those COVAX countries, to 92 lower income countries, and to the populations that are at highest risk. We're helping you do that. And that opportunity is available at gogiveone.org.
Thank you so much, Anil. And my understanding is not just that people will help us buy those vaccines, but also to get people vaccinated so that we can also distribute them from the manufacturer to the country where the vaccine is needed, but also the work that health workers need to do to get vaccines into people's arms, right?
Absolutely. It's incredibly important that we think of the comprehensive response to COVID-19 that's required. When we're talking about a vaccine, that only matters if it's getting it to someone's arm, and that requires vaccination, that requires healthcare workers, that requires cold chain, that requires planning, that requires pharmacovigilance. All of that activity is what the international community, including the World Health Organization, is there to do in partnership with national governments and local communities. And of course, vaccination is just part of our strategy. We also need tests, we need treatments. In India right now, there's a desperate need for medical oxygen, and the World Health Organization is supporting the range of those needs. Immunization is the tip of the spear. It's what's going to end this pandemic, and that's incredibly important, but that's absolutely not the scope of our work. We're doing much more, and we have to end COVID-19.
Anil, you just reminded me, yes, we're talking about Immunization Week and vaccines today, but oxygen is very important to treat patients with COVID-19. And there was a campaign, but together with there is a campaign together with our Goodwill Ambassador, Alison Becker, to actually help deliver oxygen for those in need. So maybe you can also tell us about that initiative.
Yes, absolutely. Breathe. It's so basic. We take it for granted. But one of the challenges of COVID-19 is that it requires, for people who are suffering from the virus, who have the symptoms, it requires medical oxygen. And there's a shortage of medical oxygen around the world, including in India, including in Brazil, and too many other countries. And so we do have a campaign at our website, who.foundation, to solicit funds in order to support the provision of medical oxygen through the World Health Organization.
Thank you, Anil. I'll go back to Kate with a couple of more technical questions about vaccines. Here is one coming from Alexandra Che. Why are vaccinated people still at risk?
So no vaccine is 100% protective in 100% of people 100% of the time. These are fantastic vaccines. They're highly effective. And most people who are vaccinated are going to be well protected. As Anil said, not only against disease, you have to be infected to get disease, but you can be infected and not develop disease, and yet you're still at risk of transmitting that infection to somebody else who may not be vaccinated. So the important part about this is that being vaccinated gives you great confidence that the likelihood that you're going to get sick from COVID is very low, because these are really great vaccines. But it's not 100% guarantee. And the other point here is that, especially as vaccination is ramping up in different countries, you're not in an environment where everybody around you is vaccinated. So I really want to emphasize that in these early days, as a vaccine is rolling out, it's really important that if you're one of the people who does get vaccinated, you do need to continue some of the interventions, especially when you're not with those who are part of your household. When you're out in the community, you do need to continue wearing a mask, continue with hand washing, not gathering in large groups of people. We don't want to end up in another wave. And we've seen what can happen even in countries that are starting to roll out the vaccine. Chile is an example where they're doing a great job in their vaccination program, but cases are increasing. That doesn't mean the vaccine isn't working. It means that we have to deploy all of the tools that we have to end this pandemic. We're in the early phases of this vaccine rollout, and now is not the time to be taking our foot off the pedal just as we're deploying the vaccines and trying to give them the best chance possible to shut down transmission, shut down the possibility that you're going to transmit the virus from one person to the next, and in the meanwhile, protect us from getting disease.
Thank you so much, Kate. You actually answered a few more questions where people were asking, why do we need to continue wearing masks, keeping the distance, etc., even though we are vaccinated? But here is the next question from Michelle Lewis. Have there been studies yet on the effects of COVID vaccines on those with severe long COVID?
So there aren't studies that tell us whether, if you have severe long COVID, whether getting vaccinated can result in some improvement. There are reasons why it could potentially give you some improvement, but we just don't have the evidence at this point to know whether that's the case and to be clear about whether that's one benefit. Nevertheless, for people who do have long COVID, it is important to get vaccinated because we do know that there is always the possibility of being reinfected. And as we are learning more and more about the variants, we will learn more and more about the risk of reinfection from those strains of COVID as well.
Thank you so much, Kate. And as we are marking the World Immunization Week, that is focusing not only on COVID vaccines, but broader on routine immunizations. Here is the questions from Sheena El-Jbedi. Can hepatitis B be prevented with a vaccine?
Yes, hepatitis B is one of the life-saving vaccines that every country around the world has a program. And getting hepatitis B vaccine into infants is a really critical intervention, both to prevent acquiring hepatitis B, especially acquisition during the time of birth. So this is, again, one of the life-saving vaccines. And the good news about hepatitis B vaccine is that it's packaged in with other vaccines in one shot. And so we can protect children from 5 or 6 different diseases, all with one immunization. We don't need to give them in separate injections.
Thank you so much, Kate. And there is also a HPV vaccine that helps preventing cervical cancer. So if we reach certain targets of vaccination, we may be able to eliminate cervical cancer. So can you tell us a bit about this vaccine and when is the right time to receive it?
Yes, so many of our vaccines are actually cancer prevention tools. Hepatitis B leads to liver cancer. HPV immunization leads to cervical cancer and other kinds of cancer. So we do have these vaccines that are actually cancer prevention tools. For HPV, because women obviously are the ones who are at risk of cervical cancer, we recommend that girls get vaccinated before they begin any sexual activity. And so the recommendation is that girls around the world should be immunized sometime between the age of about 9 and 14 years of age. That seems to be a time when we can deliver programs, especially in schools, and be sure that we can get the number of doses that are needed to protect girls fully against the strains of HPV that are most likely to cause cancer. There are many countries that also immunize boys. And of course, the importance of immunizing both girls and boys is because this is an infection, right? It's an infection that is spread from one person to the next. But HPV is also a cause of other kinds of cancer related to that infection in men. And so there is a very strong argument for using HPV vaccine in both boys and girls for their joint protection. But while we have any limitations on the supply of HPV vaccine, which we're still in a supply limitation, the priority is for girls around the world, every country, to introduce HPV vaccine so that girls, before they become sexually active, become immunized and protected against HPV and therefore against cervical cancer in the future.
Thank you so much, Kate. And here is a question from Asha Lata. Can you please clarify if a woman is eligible for vaccination if she is 5 days before or after the period?
Absolutely. There's no reason for any of the vaccines that we have for prevention of any of the diseases. There's no reason why you can't be immunized regardless of where you are in your period cycle. You can be immunized while you're having your period. You can be immunized before your period. You can be immunized after your period. It's really of no concern what stage you are in your period cycle. So go get vaccinated when you're offered vaccine, and it's of no concern about where you are in your cycle with respect to getting vaccinated.
Thank you so much, Kate. Here's the next question. Can pregnant get vaccinated? Our viewer hasn't specified with which vaccine, but maybe you can tell us about some examples when pregnant women are eligible to get vaccinated.
Yeah, so when you're pregnant, there are, in fact, some vaccines that we specifically recommend to be used when you're pregnant. And the reason for that is that pregnant women, for some diseases, are at increased risk of severe disease and sometimes at risk of very severe outcomes, including death. we can use the vaccination of a pregnant woman for some of the vaccines to also protect the unborn child. So a woman's immune system is also delivering antibodies to her unborn infant, and it's a means by which we can actually assure that a newborn infant has protection. So specifically, pregnant women should be vaccinated against influenza. They should also be vaccinated against tetanus to avoid developing tetanus following the birth of the child. So maternal tetanus and neonatal tetanus are really diseases that are targeted for elimination around the world. So those are specific examples of vaccines that pregnant women should actively seek and get. We also have recommendations for women to be vaccinated against whooping cough, also known as pertussis, in order to protect the unborn infant and give that newborn baby the highest antibody levels possible by first immunizing the mother while she's pregnant with the infant. For COVID vaccine and for some other vaccines, there are recommendations that if you're pregnant and you are in a group that is being offered COVID vaccine, usually because you're a health worker or because you have an underlying medical condition, there's no reason why you shouldn't get vaccinated with COVID vaccine, although we don't have specific large database on the safety of pregnant women being vaccinated, but there's no reason to believe that those vaccines are going to be a risk for a pregnant woman. So the trade-off is really, if you're being offered COVID vaccine, you have some reason to be offered COVID vaccine, and we do recommend that you go ahead and get the vaccine after consulting with your care provider to simply discuss what situation you're in with respect to the exposure that you might have to COVID.
Thank you so much, Kate. Anil, here's a question from you from a viewer in Canada who I think missed the beginning of the conversation. So can you please say again, what is WHO Foundation and who are the partners? This is the question coming from a viewer.
Sure. The WHO Foundation is a new organization that exists to support the work of the WHO and to benefit from your contributions. The World Health Organization works on all our behalfs, and what we are doing at the WHO Foundation is ensuring that individuals, mass public companies can contribute to the work of the WHO and its partners. As Kate and Alex have described in this discussion, COVAX is an initiative of the WHO and other organizations, including Gavi, that is supplying COVID-19 vaccines to countries around the world, starting with those who need them most. And what the WHO Foundation has done is create an opportunity to connect you to COVAX, to give you the opportunity to contribute to the work of these life-saving organizations. GoGiveOne.org is the campaign that allows individuals to make contributions that go directly to COVAX, and COVAX is the initiative of the WHO to make sure that individuals around the world are receiving a COVID-19 vaccine, starting with those who need them most.
Thank you so much, Anil. And I would also repeat that for people who live in the US, UK, Norway, and Germany, they can also create a fundraiser on Facebook. And Facebook will actually match your donations to buy vaccines for those who need them the most and don't have access yet. For the others, please visit the GoGiveOne.org website. Also, you can follow the WHO Foundation on Twitter, on Facebook and Instagram, and you'll get more updates as well about the campaign. I would also invite you to check our World Immunization website and our social media channels. There are different creative initiatives, and we are really inviting you to share with us your stories, what vaccines brought you closer to, or what you're looking forward for vaccines to bring you closer to in future. There are creative templates, there is a creative filter and stickers. So please, let's be creative and let's save lives with these life-saving tools that we have at our disposals. Not only about COVID-19, but many other diseases, including measles, polio, HPV, hepatitis that we spoke today. There are many others. Ebola has been one of the successful vaccines that are helping us fight outbreaks currently in Africa. So visit our social media channels, visit our website, and help us spread the word that vaccines work. Thank you.